Welcome to Taking Charge of My Cancer podcast, episode 24. I am Derly Munoz, your host, and I have the pleasure to introduce you an impressive and very dedicated plastic surgeon, Dr. Mark Leyngold. Dr. Leyngold is the CEO at the Leyngold Institute for Plastic Surgery in Idaho. He worked as an associate professor of surgery at the University of Florida from 2014 to 2022. That's where I met him, working with him and seeing him actually in action, and the amazing work that he did when he was working here with us at UF. He completed his fellowship in microsurgery for breast, head, and neck reconstruction in New York, and I can be here for another half an hour talking about all the awards and publications that he had done through his career. But I want to kind of really dive into what all the stuff that he has to tell us. So Dr. Leyngold, thank you so much for being here with us.
Thank you. Pleasure to be here and interview with you.
Okay, awesome. So you want to tell us about your mission. How do you ever want to be a plastic surgeon?
Yeah, so plastic surgery is something that I'm very passionate about. I think, it primarily started when I was a med student. And I can't say I always wanted to be a plastic surgeon, but it is something that I feel like I naturally fell into after some experience specifically in fourth year med school. I spent some time with plastic surgeons in the area. It was in Pensacola, Florida, and I did an away rotation and really fell in love with the craft. It's challenging. It's every patient's a little bit different, and I felt like it's really me and something that I wanted to pursue.
Awesome. Would you ever wanted to be a physician, or you ever thought about doing something else?
It's a good question, Darley. When I came out of high school, I really didn't know exactly what I wanted to do, but I did want to be in healthcare. I thought about fields like physical therapy, athletic training, as I was really into sports and working out. And then I think a lot of the influence came from my brother, who was kind of pushing the envelope, and thought that going to medicine would be a good idea. And I kind of looked up to him and followed his footsteps and challenged myself. And I think I kind of fell into medical school.
Got you.
But
Is he your twin brother?
Yeah, my twin brother. Yeah.
That's right. That's right. He's a plastic surgeon as well, right? That's awesome. That's awesome.
Plastic surgeon. Yep.
Yep. Absolutely. So if you didn't do plastic surgery, do you see doing another specialty or something different?
Yeah, good question. I actually initially was going into urology.
Oh, wow.
Yeah, believe it or not, and was strongly considering that field. But kind of last minute pulled out and decided to pursue plastics.
Got you. Perfect. How about, were you planning to do like breast reconstruction? I know that's the head and neck and breast reconstruction is your specialty. How do you fall into the oncology world?
Great question. You're asking the right good questions. So I went into plastics. I did my plastic surgery residency in Las Vegas, Nevada, and I kind of went into it with an open mind, not really specifically with a certain certain subspecialty in mind. I kind of wanted to experience different aspects of plastic surgery and kind of decide later. I did think about craniofacial surgery as I did mission trips to Philippines for cleft lip and palate. And then, I kind of started looking at what I was lacking at, specifically what part of plastic surgery I felt like I didn't get enough experience in residency. And, breast reconstruction, specifically breast reconstruction with free tissue transfer, as we know, the most common being deep inferior epigastric perforator flap, is something I had very little experience with in residency. And I said, I'm gonna do a fellowship, microvascular fellowship, because I really loved microsurgery. I felt like it was very challenging. I felt like it's just incredible surgery, make a huge difference in patients' lives and outcomes. And I saw that's what I did. And through my fellowship, I kind of fell in love with breast reconstruction. I and cancer and helping cancer patients.
That's awesome. Well, I can tell you the amount of like great outcomes I have still seen. Like, people are still missing you, still talking about the amazing job that you did with them. And so yeah, it's amazing, and it's amazing how much I learned as I was going into like just observing you guys doing surgery, and then as I was going into surgery and then seeing just all the stuff that you do right at that time, it's just really great to be able to do that.
Thank you. That's very humbling, and thank you. That's very nice of you to say.
Absolutely. Will you give us 3 valuable tips that you learn about your journey?
Yeah, sure. That's actually not an easy question to answer, because I probably have a lot of
I know.
things I could come up with. But I would say, number one is, and this may sound kind of generic, but to never give up and pursue your passion, because the pathway to success is not linear. It's kind of, it goes up and down, and eventually, if you persevere, you will likely succeed. So I feel like I'm no different, and I think it's just keep moving forward, kind of no matter what the challenges are. I think that's number one, and I think applies to many fields. I think the other tip is to keep an open mind. So we, as human beings, will never truly know everything, and the truth of the matter is that what we think is truth now will be obsolete in probably 50 years. So you got to keep an open mind and kind of keep evolving with the field, keep evolving as the society evolves, with new technology and just new techniques, and still stay true, kind of to your guns and to what you've learned. However, just evolve from that. And the other tip, I guess, I would say is, at least, specific to medicine, number one, take care of patients. Take good care of patients, and everything else will kind of fall into place.
Yep, absolutely. Yep, that's great. That's very valuable. How about the most painful lesson through your journey?
Painful lesson. Um, I think there's been definitely a lot of painful lessons,
I'm sure.
and I can tell you one of them. I think kind of it's so important in our field, and as you know, probably in physical, you can probably relate as a very experienced physical therapist, is being humble. Being humble and kind of understanding that first, it's okay not to know everything, and then ask for help if needed, and always be willing to take criticism, and just be humble. And I think patients and your colleagues will appreciate that. And I think starting out in medical school and residency, I think there's been some, potentially I have been not so humble in certain times, and I feel like that kind of backfired a little bit. But eventually I kind of changed. I had to really sit down with myself and kind of change some things, and I think that really helped me on my journey and to become successful.
Excellent, excellent. It's funny how when I met you the first time, where are you original from, Dr. Leyngold?
Russia.
Exactly. So sometimes, I'm from Colombia. So sometimes, we tend to be very direct, right? To the point. And sometimes, people in this culture doesn't take that well. And so it's funny how, like, the first time I met you, I was like, I felt totally great because I'm similar in regarding, being so direct. But at the same time, it's the impression you create with patients, right? So patients will love you or they won't love you, because
Right.
they feel like, man, it's like that he has any feelings behind that,
Right.
face. And then some patients like, yeah, but then after they get to know you, it's like, oh my God, he's amazing. He's great, great personality. So yeah, I can totally be related.
Yeah, there's definitely cultural. There are definitely cultural, aspects that you bring up that are true, and I think both you and I can relate to that.
Yeah,
And America is a little different. It's, you got to be, yeah, a little more politically correct sometimes. So.
exactly. That's a good way to put it.
Yeah.
Is anything that you have that will be of value for our audience that you want to share?
Specifically to what? To can you be a little
Yeah,
more specific?
exactly. So like if you have somebody in front of you who has just a mastectomy and they're
Mhm.
looking into having reconstruction, if you, I know it's a very broad question because it's some multiple things, but if you have something like, if you have somebody right now who is listening to this and is trying to decide what should I do, if you can just give them some kind of good info about maybe some pros, cons about what breast reconstruction means.
Yeah. So when it comes to breast reconstruction, obviously it's a very complicated subject, and I don't think we have enough time today to talk
Exactly.
about every aspect. However, what I would say is, I think it's important to, I think as a patient, again, I haven't been a cancer patient, luckily, but working with a lot of patients, I think it's important to slow down and kind of do your research, and not necessarily go on Google and look at all the potential terrible things that you can find, but do your research from credible sources. Like, for example, you know go see a plastic surgeon that specializes in breast reconstruction. Find out what your options are.
Mhm.
Make sure that your cancer is being treated properly. That means your surgically is being treated properly, and you're seeing a qualified breast surgeon or general surgeon who does mastectomies. If you need to see a radiation therapist, and find a good team. And I believe at University of Florida, at least when I was there, had an incredible team of doctors and healthcare providers like yourself to take care of the patients. So find a good team and kind of listen to them, and then make an informed decision, as far as, based on that information, what would be the route you want to take, because it's not a simple answer. So I think it's kind of integrating what your healthcare providers are telling you, and also what your personal goals are, and what you envision yourself, how you envision yourself looking, and overall your lifestyle. Are you willing to undergo a long recovery process? Are you a very active person? Those type of things. Your medical condition, like, do you have diabetes, heart disease? Are you obese? And all those things. So that all has to be taken into consideration, and then you kind of make an informed decision once you get that information. Because initially, as you know, with cancer, especially breast cancer, it's extremely overwhelming, because these patients they get so much overload of information, and it's not easy to decide. So
Got you. That was very valuable. Many patients are like, gets really concerned about like, I don't want more surgeries. I'm done with surgery. And sometimes I tell them, it has to be your personal decision, but don't just go by, I don't want more surgeries. I always tell them, and you correct me if I'm wrong or not, because you see that from your aspect, but I always say to them, if you look yourself in the mirror and you don't mind to see what you see, then you should be okay without surgery. But if you feel really bad and sad and you don't even able to look yourself in the mirror, you may want to look into reconstruction, because that's something that is going to always remind you that you went through your cancer, and it's never going to let you close that chapter. So I don't know if you have like, what do you tell patients, like if they're like not too sure, my husband wants me to do it, but I'm not too sure, and my mom, or those influences about like what is the best decision to make.
yeah. Well, what I tell patients is that breast reconstruction is a journey. All right. So if you really want to go from not having breasts to having breasts that resemble natural breasts, it's usually more than just one surgery. I say, it can take up to a year or longer, depending, whether you have radiation, chemotherapy, all these things, to create symmetrical breasts. Because it's not, one plastic surgeon I was just reading a forum said something that I can really relate to. He said, if there was only one breast and there wasn't a nipple, breast reconstruction or breast surgery would be easy, right? but there are two breasts and there are nipples and areolas, and the goal is not just to create a breast, but to create symmetrical breasts, to create breasts that patient is happy with. So that has to do with volume, shape, overall projection. And that's no easy task. So for folks that are not sure, a lot of times what I found is that with time and them seeing results, it kind of works itself out where they start realizing what they want and what they don't want. Because I think some women, they have to live with their results or lack of the results for some time to kind of finally realize how they feel.
Okay.
Because it could be a series of experiences or events that leads them to say, you know what, I cannot live like this. I'm willing to do whatever it takes. And that could be where they have, certain social, like a feeling of disfigurement, or they don't feel, that they don't feel normal wearing clothes or in front of their significant other or in public. And that something usually happens, or some series of events happens that leads them to go one way or the other.
Okay.
But yes, there are some patients that are okay with not having breasts or just having something that they, maybe like a breast mound, that they feel at least they have something, and they may either be okay with it or just not willing to go through more surgery and accept what they have. So it's an individual type of, decision. And I don't push anybody into anything. I kind of just listen to the patient and try to come up with the best solution. So
Great. How can people find you?
So I am currently in an area called Meridian, Idaho. It's pretty far away from from Florida, but we do exist. It's a real city. It's a Treasure Valley area. So if you go on our website, LeyngoldPlasticSurgery.com, the all the information is there. How to contact us. We're also on Instagram. At Leyngold Plastic Surgery. I have my own Instagram at Mark Leyngold, a professional Instagram. So the contact information is there, and so we are there. Yep, in Idaho.
Great, awesome. And then I will write that information on the podcast description so people can have access to that. So how about 3 books that you would recommend to the audience, and why?
Yeah, it's a good question. I actually thought about this question this morning. And I was like, well, because I have read a few books that I felt like really changed the way I think just about life in general. And I think they do have an impact. So there are obviously many very good books, but one book that I recommend is by, I believe, Harari. Can't remember his name, but Harari. He's an Israeli writer, called The History of Humankind. It's a small book. Easily probably can read it pretty fast. The other book is by Dale Carnegie, called How to Win Friends and Influence People. I think it's a book that was written about 100 years ago, and a lot of the concepts, all the concepts still are true to this date. I think that's a great book. And then finally, the other book is by former FBI hostage negotiator named Chris Voss, and the book is called Never Split the Difference.
Oh, nice. I'm writing them down here.
Yeah.
Going through all this is amazing. This stuff is like, I need to now have another, like, stop working for 3 months or longer just so I can read the books you guys recommend, all the podcasts that you guys recommend. This is really cool.
Yeah, there's so many amazing books. We don't have enough time to but a lot of them are, the good thing is a lot of them are on Audible.
Okay.
Like all the books I mentioned are on Audible, and you can just listen to them in your car as you're driving to work. So
yep, exactly. That's what I do my podcast. How about podcast?
Well, I do listen to some podcasts. I think they're mainly professional podcasts and plastic surgery podcasts. So I
Yeah.
don't know. A lot of residents would, I mean, a lot of non-plastic surgeons would necessarily enjoy them, but there's one, it's called the Resident Review. When I used to listen to that one. They kind of go over a lot of topics in plastic surgery, and it's a little bit of a review for me if I forget certain subject. The other one is the business of aesthetics, because my practice right now is, I'm running a business, and I do have been doing a lot of aesthetic surgery. And the other one is PRS Global Open Podcast. So essentially it's kind of discussing, inviting different kind of renowned plastic surgeons to the podcast and discussing certain topics, anything ranging from pediatric craniofacial surgery to hand surgery to breast reconstruction, those type of things. So it's a lot of it's just professional podcasts that I've been kind of listening to.
Okay. And then there's another part of your life that I was like totally like so cool to see, just because again, we'll see each other, or we used to see each other at work, and then you just kind of talk about work and patients and plastic surgery. When we became friends on Facebook, and I see that you do body sculpting as for fun. So you want to tell us a little bit about that?
Yeah, sure. So I've been really into, in high school, I was an athlete. I was a wrestler, and I was a track runner, and I got really into training and working out and fitness. I think in my teens, and that lifestyle I kept up that lifestyle. A lot of it was mental, and it helped me deal with stress and overall just created a sense of well-being, almost like a dopamine. I needed dopamine release. And I think I kind of really got into the bodybuilding lifestyle, and I have competed in shows, and I kind of do it. I still do it, and in fact, I'm maybe doing a show in October, and so that's kind of what I do a lot of my off time. I like I like nutrition, focus on nutrition, fitness, going to the gym for 4 or 5 times a week. I like outdoors a lot, especially now living in Idaho. I've been blessed with the just great outdoors and get a chance to explore. So yeah, that's a big part of my life. I think fitness and just being outdoors.
So do you think that coming from somebody who, many times if we just again take it to a patient that I'm doing a body composition and talking about how important it is to change their body fat to increase the skeletal muscle mass, nutrition. No, what is the first thing we get it like, I really don't have time. I have kids, I have this, I have that. It's just really not that something that I really can dedicate time. And then when you start to bring like more information about now is a correlation with with high VMI or increased body fat with lymphedema and breast cancer recurrence, and when you start to talk to them about that, they're like, oh my god, I gotta do something about it. So I always say, because I work out as well, not as much to do, because of course certainly you have to have a lot of dedication to do body
well, your son powerlifts, right? Your son is into powerlifting.
Yes. He's doing. Yeah, he's my guy who's doing powerlifting through the Special Olympics. So yeah, he's really
awesome,
that. Yeah, he's doing that. But as well. So what advice would you give to patients? Like how, like coming from, again, you're a very busy man who is like, if you're not in surgery, you're working out. That's pretty much your life. And so what tip would you give to people to try to engage them to improve their fitness and their exercise and their nutrition?
Well, as a physical therapist, you can probably tell me more about that than I can, because obviously you understand the body mechanics and ergonomics, very well. What I've learned, and again, I'm not a personal trainer or anything like that, but I do have those discussions a lot with patients, because obviously I do deal with body contouring and patients that are overweight and trying to lose weight, and what I would commonly hear is, oh, I can't. Is it the time excuse, as you mentioned, or that they couldn't exercise because, for whatever reason. I would say the tips that I usually give is one, for patients of normal BMI or even maybe above average BMI, I think focusing more on body composition rather than weight is probably more important, because that will get them healthier rather than just trying to lose weight. Number two is when you do exercise, focus more on intensity rather than duration. So I feel like we don't need as much exercise as we think, but it's the intensity that counts. Now, having said that, you got to be safe. You can't just go out and hurt yourself and try to lift a bunch of weight or do something to end up being hurt. But at the same time, gradually increasing your intensity, and you keep your workouts short, maybe 45 minutes. I also personally, I do every morning, I do mobility work, and it's just it's 20 minutes, 15-20 minutes. So I wake up a little bit early, and before surgeries, before clinic, I do mobility work that includes range of bands, upper body, lower body exercises, very light, no weights, but just something to just keep my mobility up, keep my flexibility up. I think that has helped me remain pain-free and not having a joint or neck issues, even as I kind of get older. And because a lot of surgeons do have that, as they have a lot of issues, musculoskeletal issues. So that's another thing that I recommend. And then finally, I think most importantly is your nutrition. Because as a lot of times we gain weight not because we lack exercise, but because we overeat. So I think a lot of it is just kind of learning how to count your macros, potentially eating smaller meals throughout the day, and just kind of not overeating, higher protein, maybe a little bit lower carb, and staying to whole foods, less processed foods will also help.
Perfect. That's awesome. Is anything else you want to tell us before I let you go? Any other good tip in general?
Well, I just want to say, so for having cancer is something that is a diagnosis that I think patients are obviously they kind of become very shocked when they first hear it, and it's definitely not easy to hear that. But just to know that there are dedicated healthcare professionals that are out there that are working hard through research, clinical practice, and just overall patient care, good patient care, they're there to help. So there is help out there, there is hope, and you just got to keep your head up and then think positive.
That's amazing. Thank you so much, Dr. Leyngold. Thank you again for doing this with us. So great to see you again via this, so we don't never lost touch.
Yeah.
Wish you the best on your practice. And like I said, people here at UF is still missing you. So
yeah, thanks for reminding me, Darley, and yeah, keep in touch.
okay,
Appreciate
absolutely. You have a great evening.
it. Yeah, bye-bye. Yeah.